Greetings to all. My presentation is entitled A Narrative Review of Vaccine Hesitancy in Childhood Immunization in Malaysia. Vaccine hesitancy is defined as delay in acceptance or refusal of vaccination despite availability of vaccination services. Vaccine hesitancy is complex and context specific, varying across time, place, and vaccines. It is influenced by factors such as complacency, convenience, and confidence. Malaysia is one of the countries in Southeast Asia that has achieved high immunization coverage since the National Immunization Program started way back in the 1950s. Sadly, however, due to vaccine hesitancy among parents, there has been a resurgence of preventable childhood communicable diseases since 2013. Therefore, the aims of this study are to examine the prevalence of vaccine hesitancy in Malaysia and the factors that contribute towards vaccine hesitancy. The method used in this review is through a systematic search of 3 databases for articles published in 2015 to 2022. The 3 databases are PubMed, Mendeley, and Google Scholar. The search terms used were vaccine hesitancy, childhood immunization, delay, refuse, and Malaysia. Only articles in the English language were accepted. We also include articles that measure the prevalence of vaccine hesitancy and studied the factors that contribute to vaccine hesitancy. Both qualitative and quantitative type of studies are accepted for review. This is the flowchart of the literature selection process on articles that were finally found appropriate for the narrative review. Articles were searched from 3 online databases using the criteria and inclusion mentioned earlier. 11 articles were from PubMed, 90 from Google Scholar, and 45 from Mendeley. Articles were screened for their titles, and titles of 33 articles were found to be related and appropriate. Duplicates were then removed and full-text articles were retrieved. The final number used for the review is 10. Results and discussion. Prevalence of vaccine hesitancy. Prevalence of vaccine hesitancy from studies using validated questionnaire to measure it is 6.8% to 11.6%. The tools are mainly adopted from previous studies, and the questionnaire is either self-administered or delivered by interview. Studies that use vaccination records as sources of data were able to differentiate defaulters from mothers or parents that refused vaccines. The prevalence of refusal is much lower, as vaccine hesitancy stretches from the complete spectrum of vaccine refusal to complete acceptance. From this review, the prevalence of vaccine hesitancy ranges from 0.03% to 20.7%. In terms of factors influencing vaccine hesitancy, by demography, there is no relationship with religion. vaccine hesitancy can occur among both Muslims and non-Muslims. More Muslim mothers were hesitant in the rural states, while more non-Muslim mothers were hesitant in the urban areas. For education, a relationship was found whereby mothers or parents with lower education level are more likely to hesitate vaccination for their children. Other factors that was found to influence vaccine hesitancy include beliefs and convenience. Belief in alternative medicines, especially homeopathic medicines, is a strong factor that causes mothers or parents to refuse vaccination. Mothers or parents who doubt the content, effectiveness, and the safety and halal status of vaccines are among those who are vaccine hesitant. Obstacles towards giving vaccination, such as long waiting time and long traveling time to health center, will cause parents or mothers to default the vaccination for their children. Therefore, in conclusion, vaccine hesitancy is a public health problem and ranges from complete refusal to final acceptance of vaccination. Vaccine hesitancy is complex and can be contributed by multifactorial reasons that include mothers' or parents' demographic characteristics, vaccine-related belief, behavior, and convenience. Policymakers need to implement targeted preventive measures and address hindrances that resulted in the delay to vaccinate. And these are my references. Thank you for listening.